So now we're going to talk about respiratory emergencies. No matter what the respiratory emergency is, there are a couple things that are really important. Obviously, you want to get the patient's temperature to make sure that they do not have a fever because they could have a bacterial infection, such as pneumonia. You want to make sure you have the respiratory rate, and you want to make sure that you have a good O2 sat. Patients who have respiratory problems do not want to lay down. They cannot lay down, they can't breathe. If they have fluid in their lungs, they'll feel like they're drowning. They'll be very short of breath. So you want to sit them up to the point that they're comfortable and that they're breathing okay. So again, EKG may be necessary because respiratory and cardiac problems affect each other. Someone can come in with shortness of breath and we find out that they've actually had a heart attack. So generally you're going to do an EKG on that patient. You're going to get blood unless nursing is starting an IV, which they probably will do. So lots of different problems can be causing respiratory issues. The patient can collapse a lung. Um, the patient could be in a car accident and have a chest injury that their part of their chest is moving in different rhythm than the other side. It's called a flailed chest. So patients who are respiratory compromised generally need oxygen. And we can deliver oxygen many ways through a nasal cannula, which is just two prongs that go into the nose and it connects to the wall oxygen. We'll go over this in class. We also have simple masks, non-rebreather masks, and Venturi masks. But we'll go over those in lab so you can just see the difference. ER techs are responsible to assist nursing with actual suctioning in patients, but they don't suction per se because suctioning is actually a invasive procedure that nursing has to do. So I'd like you all to review the table on 4-3 so that you can see the different types of oxygen delivery devices. And of course, for the patient who's not breathing on their own, we do have the bag mask valve. Oral suctioning is done by ER techs, and that is with a hard catheter that we can just put in the patient's mouth and suck some of the secretions out. But again, we don't do that more than for 10 seconds. Sometimes a patient will need to have a chest tube inserted, and this is done in the emergency room, and that can be done for removal of air, blood, or fluid from the pleural space. And the ER doc will just have the patient turn on their side. The side that he's going to put the chest tube in will be the side that is up, and the ER tech may assist with that procedure, along with gathering things such as the container to catch the secretions and the sterile kit, also helping secure the sterile field. Patients need reassurance when they are getting a chest tube because they're very scared. So again, part of the role is communicating with the patient effectively to know, are they in pain? Are they doing okay? How do they feel? Are they worse? Are they getting better? And we can do all this through effective communication. So most of our respiratory stuff will be done in class. I'm not going to get into individual disease processes, but rather what the ER tech role is, and we'll do that in class later this week. I hope you have a good weekend.